So a little bit, just very briefly about the speakers. You'll learn more about them when they speak to this topic. And so Ben works at the Rocky Mountain Institute and is now working on transportation issues in Austin. And he'll tell us a little bit more about the unique model the Rocky Mountain Institute has and why, I'm sure he'll share with us why they chose Austin. But we're very grateful for you to come and share your expertise because transportation is just a minor issue here in Austin. No one ever brings it up. When I was being recruited, it was not the number one thing that people brought up as potentially the issue that would drive me away. Beto Lopez is one of the many people, but it was really special to me, that I've met through the exercise we're doing here in Austin. So because of our unique mission, we have brought people from Austin back to Texas and Austin, and Beto is one of those that has come back. He's actually an alum from UT Austin, and he was in San Francisco just before this, but he's come home. And he's previously from the global design firm IDEO. Beto can speak to probably any topic you bring up. He is a systems design thinker and a person that I love to have conversations over a drink or coffee with.
Anytime.
Senator Watson is someone that I'm continuing to grow to know more. Mm-hmm. But I had he was pivotal actually in bringing me at least here, because when he framed the opportunity that Austin had, and the way he framed it, there was a moment, I don't know if you recollect, Senator, but when we were sitting in your office, when I realized for the first time that this was a microcosm of the American dream that brought me to the US many, many years ago when I was 18. And until that conversation, I hadn't made the connection. But I do feel like the opportunity here is one of these grand opportunities. It's not easy, it's really hard, but what the hell, you know, you're in Texas, right. Big, or go home. So I really love that, and Senator, you introduced me to that perspective. So this is the august group that we have, and I hope to have a good conversation amongst all of us. I was going to be the last person speaking briefly to set us up for the conversation, but I asked the senator where he would like to go, and he'd like to go at the end, and I have learned a few things while I'm in Austin. When the senator says he's going to wrap up, he's going to wrap up, and also he's going to wrap up not just because he asked, but because he's going to do it really phenomenally well. So instead, let me kick off with the health opportunity, which actually makes sense. So I'm glad that we're doing it that way, and then go around the group, and each one of us, what I'm hoping is we spend just a couple of minutes putting our own spin on smart city and smart city for health. There are some loaded words in there, so I'm hoping that we go out of bounds with that terminology and don't do what's expected with it. And I'm pretty sure that none of the folks on stage do what's expected in general. That's good. So from my perspective, what I want to introduce you very briefly to is our vision of turning Austin into a model healthy city. There are lots of elements to that. I will tell you that some of the core elements are sometimes unexpected. So for us, a core element to this is to actually change the business model for health and healthcare. Because we believe if you don't change the financial incentives of the system that we have, nothing else will change. And so that's actually at the heart of the innovation that we want to create. To change a business model for a system like health and healthcare is a very hard thing to do. That is part of what we want to demonstrate here, and I will argue that to be a smart city, and I want to get back to it at the end, to be a smart city, you've got to think about the design of financial incentives that keep the smartness going, that seed it, but then keep it going. There's actually sources for startup funding for a lot of initiatives that can kick off sort of smart city efforts, but to keep it going requires a different kind of design, and so that's a big piece of what we think about, not just for the city, for us specifically around health. And I'll introduce one specific idea that we would like to roll out through Austin that we've begun making some strides on. So the idea is to create a mechanism which will include a large digital component, but of course, like anything real in the world, has to include people and communities and incentives and a variety of different partners. And that is to instead of thinking of smart health and healthcare as an individual or several individual technologies and tools, or one or two or more health institutions, what we want to do is imagine everyone as a creator of new ideas for health. At least certainly anyone that might want to call them a practitioner in health. And frankly, most of you all, if not all of you, are practitioners in health. You are a parent, you are a child looking after an elderly parent, and if you think about it, you're actually spending much more time with the patient then than any actual practitioner, formal practitioner like a physician or even a nurse would. So our vision is that we betcha, as you're doing your day-to-day work, looking after your loved ones, and or the practitioners with more formal degrees on the ground, those are the people that have great ideas about how to improve health and healthcare. Now, you know that there are many mechanisms to tap into those. We have hackathons and ideathons, and we have one going on called Hive Health Hive.
That's right.
And those are all very important because they set mechanisms in place to get your ideas. For us, though, that's not enough in the big picture. So the difference is in what we want to create is we want to tie a system of idea generation to a couple of key issues. One is rigorous vetting, which you will get in the Health Hive competition, and you get in some of these others. But a way of vetting, which not only includes sort of the specifics of the protocol or the technology, also includes things like, is this even adoptable? Is this scalable? And frankly, does this bring value to the system? What are the economics of what you produce? Because if the economics don't work, we don't believe that the intervention can be sustainable. But finally, the last piece that's so critical to this sort of platform that can match people with ideas to those at vet, the last part they need to be connected to is people that will fund and systemic people in charge of large systems that can actually take these ideas and then make sure they're implemented. So in our minds, if that final loop isn't taken in, the final piece isn't taken into consideration, you've only made little bits of change in the way people think, which is important, but not so it's necessary but not sufficient. So for sufficiency, you've really got to plug this into the CEO of a hospital chain saying, yes, if ideas are coming up from the ground up, I commit that is the route through which we will become a learning system. And those ideas are not just on a side little innovation channel, but they become the core pathway for our industry to evolve and innovate, something actually that doesn't happen that much in healthcare. So I just wanted to lay out one component of our vision for making Austin a smart and healthy city. And smart here for us means that you're really going to the people that are smart in this case, which are the people on the ground, the people that are doing stuff, and therefore the people that are coming up with great ideas. But to make it truly smart, you've got to connect it to the levers of change. And so just exposing the smarts of folks is not going to be enough. It's connected to the levers of change, which include people in charge of the systems as well as people in charge of the money to pay for these systems. So that's my spiel on sort of one approach to thinking about smart, healthy city. But let's just go around this way perhaps. And Ben, especially given your perspective coming both from Colorado and then for the lens of transportation or frankly any other lens you want, this is your chance to riff on smart city, healthy city.
Yeah, so it's interesting timing. We have been very involved with the Smart City Challenge that the DOT, or Department of Transportation, put out. We found out today if Austin is in the top 5 of cities that will then move forward with fleshing out this application to envision kind of what a smart city looks like from a transportation perspective. So you hear, when it comes to smart cities, you hear a lot of the same buzzwords of the real-time data feeds and sensors and better understanding traffic flows. But from my perspective, I think there's a great deal of potential in, of course, doing those things, but looking at how they interact and can further health and activity for the populace. So simple things like better access to bicycle pathways and sidewalks. And Austin's an interesting place. We came down here because, in large part, we want to learn from the experience of working here and then take it to other cities around the U.S. We're sort of at this cusp right now in Austin where, there are a number of things that we're doing on the ground with transportation, or that the community is doing with transportation, improving highways, expanding bicycle paths, installing sidewalks for pedestrians. And we have the opportunity, kind of in the smart city approach, to treat it as a living lab. And of course, that's another kind of buzzword, but we have potential, I think, to really test out a number of projects on the ground and measure the success, and actually publish what works, what doesn't work, and take that to other cities. So we have a first scaling city for our project is Denver, Colorado. So we'll kind of take what we learned here, try it out in Denver, and vice versa. And that's sort of that's sort of our approach for a smart city standpoint. The transportation lens, I think that is most relevant to this subject is, of course, active transportation. As I was saying earlier, bicycling and pedestrian walkways.
I'm just going to quickly ask a quick follow-up question. So why did you choose Austin? And I know it's not because we have phenomenal sidewalks. I brought this up early on. I'm stunned at the sidewalks in Central Austin. I'm just going to tell you, I wouldn't want my parents to be walking on them. And then somebody told me, I said, oh, something about sidewalks. And they said, no, there's usually a sidewalk. It's often you have to cross the road to the one sidewalk that's on the other end and back. So it's not because we already had great sidewalks. Why did you choose Austin?
So we looked at a number of cities around the U.S. and came down to just a handful. And really, what was interesting to us about Austin was just the great deal of enthusiasm here in the community. Of course, there is kind of a pain point there with congestion. Traffic tends to be the number one issue in Austin, but there is an enthusiasm and there's a will to address some of these challenges, I think, across the community. And it's a very vibrant entrepreneurial community where there are people taking innovative approaches to solving these challenges. And we just basically looked at the opportunity to work with some of these folks and thought we could learn a lot from them and perhaps bring some value to the table as well. But Austin is, there's certainly a number of challenges here. But I think that's what makes it that's what made it enticing for us. Yeah.
Great. Beto, hit it.
Well, so in talking to Minnie for the past, 8 months now, we launched last year the Design Institute for Health at South by Southwest. And the backdrop of what we're doing here is around transformation and disruption of a healthcare system that is broken. Anytime someone begins to think about what it means to design a new version of that, human-centered designers don't actually start with things. They don't start with a thing that we need to recreate to make it more desirable. We start with an experience we want to change. And if you think about the experiences that we want to disrupt and change, they're not about the hardcore medicine that gets delivered. They're about the experiences people have getting to healthcare, navigating healthcare, dealing with healthcare, connecting the dots for healthcare, and even after something happens, understanding the financial burden that it creates and all the things that come with that. When Stacy and I began to think about what it would mean to bring design into this city and begin to think about it more from a user perspective and a consumer perspective, it had so much more to do with what are the experiences we want to change in this community that today are unfulfilled and promises of what healthcare should be, and often disappointing in the ways we connect and build relationships. And this idea of smart cities is actually part and parcel to the future of any health ecosystem. And to take a step back, let me qualify what smart means. It's not this idea that we're going to pass a Turing test and make everything AI and everything's just, when people talk about smart products or smart services, they talk about two fundamental things when you're designing them. They talk about the ability to understand you, so understand me and my preference. And then once you do, can you help me make decisions? Can you help anticipate the things that I need? Those are smart products and services. And that's the boundary for which we can begin to think about a smart city. Now, the big question, I think there's lots of questions here, is what's the functional unit that we're thinking about? Who do we need to empower? Who do we need to understand their preferences? And who do we need to begin to anticipate how we can help them? In a smart city that needs to cultivate new offerings, that could be an organizational unit of a startup. It could be, from a user's perspective, it could be the organizational unit of a neighborhood. It could be a household. It could actually also be an individual. Those are questions that we need to really understand in order to empower a city to think ahead, know the people that it wants to serve, and think ahead about how to serve them. That, for me, begins to speak to what we need to create in terms of smart cities. The intersection of health is that health gives us a goal. Health gives us a purpose. You see a litany of products that are under this tag of quantified self, Fitbits and other devices that are capturing your information, but they're just measuring something without giving you a purpose for what to do with that information. your health is a complex goal. It's not an experience. Your health is made up of so many different aspects that you can't just reduce it to a dichotomy of cheeseburger or a tofu wrap. You have to begin
Thank goodness.
You have to begin to expand the notion of what our health goals to be about. Yeah, some of the science, we're advancing genetics so that we can begin in the future to think about precision medicine, but we're also everyday people that need to understand what to cook for dinner. And that has a nutrition component, which has a health component, which gets to our goals, which gets to the way we think about ourselves, which can motivate us. We need to find those anchors into how we think about our health and the goals that we think about so that we can empower a system around a goal. We don't want a smart city just for smart purposes. I mean, it has to have a goal. And so when I begin to think about how we can do that, the medical school and the health ecosystem that we're creating here plays a role in being able to begin to project what are those things that we should be striving for, paint the North Star, if you will, and then have folks around the community begin to pull together an integrated fabric of how we can together work on that.
Thank you. Senator.
Sure. I guess where I'll start on the concept of a smart city and the role of health in that is where we started just now a few years back when the community, when I laid out a vision of 10 goals in 10 years. And those goals included a new medical school at the University of Texas at Austin, to answer the question about why in the world do we not have a medical school at the University of Texas at Austin. A new modern 21st century teaching hospital, uniquely Austin health clinics, meaning having them out in the community and in neighborhoods where people could be cared for, and another number of other items, but one of the other items I'll mention as part of this is better behavioral health in Austin and Central Texas, and then some other items. The reason I bring that up is because from the standpoint of being a smart city or a smart community, it seems to me, is that all of those things have now been embraced as a community effort. And that's very important, I think, in the way we look at this, because it's not just that the University of Texas at Austin now has a medical school, or that the city is getting ready to have a new modern 21st century teaching hospital. Instead, we have a medical school that is uniquely in this country tied to its community in the way it's being funded and the way it's going to operate. We have a 21st century teaching hospital, but the 21st century teaching hospital is also the key safety net hospital in our community. And we're opening and expanding clinics throughout the community. Now, I mention that because there are a couple of factors that I think went into that and that we have to look at as we go in the future. One is, to be a smart community, particularly as it comes to health, I think the community as a whole has to be invested in it. And I think this community has indicated it's willing to invest in its future and invest in healthcare. There is little question that when Central Health pretty bravely went out there in 2012 and said we will be a part of expanding healthcare in our community, and said we're going to ask you to raise your property taxes, and the community did that. There is no question in my mind that one of the biggest selling points on that was the fact that the community was investing in healthcare. So investment, and total investment. The second part of that I would say is a willingness to take a risk. And in order to be a smart community as it applies to healthcare, or a smart health community, there has to be some risk being willing. The community has to take some risk. And that's what we're doing. Now, the beauty of that, in my view, is we had a vision for where things might go. But now that we have the medical school and we have folks that are helping design kinds of things, I must admit, I thought the vision was big, but it was bigger than I thought. And that's part of the beauty of it. And I think the community was willing to take that risk along with those of us that were out there pushing that. So now what's that mean for the future? Well, I think it means a couple things. One is we have to, the smart things that you're hearing that are happening, we have to continue with. But we also have to make sure that in Austin and Central Texas, as we face challenges like transportation and others, we're not paralyzed by any fear of failure, and we're not paralyzed by worry that some better idea might come along someplace else. And so we don't do it, because what if we do it and then a year from now somebody had a better idea? We have to be willing to move forward. Part of that, I think, is why Austin has been successful. You know, I tease that the #1 bumper sticker here in town ain't what it ought to be, which is Kirk Watson for state senator. But it's keep Austin weird. Well, what that means to me is keep Austin open to the new ideas and the new thoughts and trying it in a different way and creating an ecosystem where that will occur. The announcement yesterday of the Innovation District around the medical school, teaching hospital, and Central Health's property, that is to help keep that weirdness, if you will, because every idea, the first time you hear it, probably sounds a little weird to you. How do we keep that flowing as a smart city so that those new ideas will get cultivated?
Great, thanks. And part of being weird, by the way, is continuing to be skeptical as well. So I think those go hand in hand, both the willingness to take risks, but also being skeptical. There's a couple of other talks. There's one a little later about whether it's hype or reality. I think these are all the questions we should be asking ourselves. We ask ourselves that as well. And I just wanted to actively share, certainly with the folks in Austin, that just know that we will spin our story here, because you can't shoot for big things without shooting for big things. But that does not mean that we think it's easy, that we think we're right, et cetera. So I think that's actually a really important part of questioning. And we'll get back to it, because I also want to push on this word smart, which is loaded, loaded in so many ways. But we'll get there. First, I want to go to a totally different end of the spectrum. We will emerge from that, I promise. But I think we need to start there, which is, I want us to think about the folks that we actually have here. We're talking about Austin as a model for smart city. It's true in other places, but some of the stats for Austin are exceptional in ways that are not that great. So I was looking at, for example, the stats about how educated we are. This is the wrong. I just printed out the wrong table, so I'm going to try to remember the table that I had looked at this morning. But essentially, almost 50% of people in Austin have a bachelor's degree or a graduate degree, which is really, really high, and it's higher, of course, than the Texas average. Or is it a college degree, bachelor's degree, and a graduate degree? But basically much higher than the rest of Texas. But when you start looking at poverty levels, we are also much higher than the state of Texas on average. So that discrepancy between like having highly educated, but generally sort of is what you would associate with sort of the word smart in more ways than one. I'm not saying it's right. And then on the other hand, also have the highest poverty rate is very troubling. And as far as I'm concerned, we can't be building a smart city if we don't come to grips with it. So, I was at a talk, I'm going to give a small little pitch. I never do this, but I will, for my husband who works around food, because there was a fun talk with Sam Hellman-Moss at Odd Duck, and if you're from Austin, you know about Odd Duck. Very supportive of local food systems. But both of them, one of the major points, and the reason I'm bringing it up, is that, well, it's all very good to talk about food and access to food, but essentially the problem is poverty. If you're too poor to buy good food, that's the heart of it. It's a complicated answer, but that's the heart. Help! I run across this all the time. We're coming up with such cool approaches, new ways of funding, blah, blah, blah. But the fact of the matter is, if you're so poor, you're not going to be able to get to places, or you can only use a bus to get somewhere, and that's going to delay you getting to some places. And I know I have an internal conversation with myself so many times as I look at what we're doing, and then sometimes hear a story that shows me that even as far as we're moving, it's going to be out of reach for a lot of folks. So I want to start there. We're going to move out of that. It's both sad, but I hope we can come up with some interesting and uplifting ideas. But I feel like we do need to grapple with health disparities and the reality that we have a large population that is poor. And by the way, our federal poverty level numbers are crazy when you think about a city, right? So I think the federal poverty level is like $12,000 a year or something. 200% of the federal, the first time I heard 200% of the federal poverty level in some economic analysis, I thought, oh, okay, so how generous are we being? And that's like 20,000 plus a year. So you can go up to 400% of the federal poverty level, and you're basically talking about people that can't live in the city. And it's pretty close to what teachers make, by the way, which is terrible. So given this context of haves and have-nots, but also the absolute number of people, a percentage of the population, that really is going to find it hard to do even basic things. What does smart mean in that context? And I know, Senator, I know Beto's waiting to jump in, but I also want to just go back, I want to get there, but I want to go, since you brought up the innovation zone and our new nonprofit that will help oversee and guide the development of the innovation zone. I know you have grappled with what it means for the other parts of our population, and that the word innovation in this case should not leave people behind.
Yeah, well, I don't think we would, I think the public invested in a smart city, healthy city, medical school, and all of that, in part because it wanted to address exactly the numbers that you were just talking about. I don't think, so let me riff on it in a couple of ways. One is, in this town right now, we're in this great debate about affordability. I mean, you're supposed to say that, if you're in elective office, you're supposed to say that at least once a speech, affordability. And unfortunately, what's happened with that is affordability, in my view, has become really far too narrowly defined. It's become defined as really property taxes. How much am I paying in property taxes? And maybe, can I buy that house that I want? That has become the definition of affordability. And that's far too narrow. The concept of health care and being healthy is far more fundamental, I believe, to affordability in a community than is just property taxes in isolation. So, for example, someone that is not able to get all of the, let's use insulin, or keep their blood sugars monitored in such a way that they feel good, or they're not in the hospital or having to go to a doctor, that has an impact on their ability to work. It has an ability has an impact on their ability for their spouse or others that they are helping with. And that makes a difference in terms of affordability. The cost of their health care makes a difference, and being healthy plays a role in what they can afford to do in the community. It's also important because one of the things that happens is if we're not doing a good job with health care in Austin, one of the things that we will find is that it becomes, the children then are not, we're not teaching the kinds of things that need to be taught so that they're in a situation to also be healthy and make the kinds of salaries and make additional incomes, if that's what's necessary, to live in an affordable place. Healthcare is a key component, and it gets lost in the debate. So, for example, to come back to the innovation zone, since you mentioned that, a couple of things about the innovation zone. One is, if you look at what the initial geography of it is, it includes the Arch, the Resource Center for the Homeless. Well, that's a key part of what we ought to be paying attention to when we start talking about health in our community. That includes things like just what we generally define as physical health, but it also involves mental health and how we make that a part of what it's part of why it's part of the 10 goals in 10 years is how we deal with that. In addition, the Central Health property is 14 acres of property that is highly developable. And there's a lot of different types of pressures, as always happens in Austin, Texas. When a piece of property comes open, everybody says, oh, I've got the best idea for that property. And it might not make any money. Central Health has an asset that, in my view, it should be maximizing the income and asset so that it has more money to meet its very specific mission. And what is that mission? That very specific mission is to provide affordable health care for folks that fall into some of the statistics that Minnie was talking about. So we ought to all be encouraging them to develop the fire out of that property so that they have the money to be able to contribute better. They're a very specific purpose governmental entity, and we ought to avoid the Austin way of saying, oh, I've got the best idea for that property, and it may not return value. So I don't think we ought to, I guess I would say it in two ways. One is it's the right thing to do. It's the right thing to do. It's to make sure that all of the community is healthy. But the second thing I will say is I think that's what the investment was all about, was trying to figure out how we get there. The beauty, and I'll say one last thing and then I'll be quiet about this, and I've said this to the dean in a kind of a semi-public forum. I said one of the things that I was concerned about when the dean was being hired was that we would get some MD, PhD, pointy head.
He is an MD, PhD.
Yeah, he is.
And he's kind of an MD, PhD pointy head.
Well,
I'm not
no,
sure
see,
where this is going.
let me finish this. Let me finish this. We would get some MD, PhD, pointy head that wouldn't get the community. It would be some ivory tower dean of the first medical school to be built on a tier 1 research university campus in decades. Instead, what we got is an MD, PhD, smart as hell, but he really gets the concept of how you play in the community and you address these things like poverty. Otherwise, you wouldn't have Minnie and Beto and others. So I think we're on the path to achieve those things, but we're always going to have to keep it at our forefront and go back to what I was saying. We have to allow for an ecosystem that doesn't define things by the way we think it ought to be, but by the way it can be and be bigger.
Great, thanks. Beto?
Well, there's lots to talk about.
I know.
So I'll build on the last comment from the senator, which is that the first thing that we did when we got here and started the Design Institute for Health was, despite what everybody was hoping that we'd do, which was to tell them what we were going to design, we actually spent the first 6 weeks talking to people in the community. That was the very first thing that we did. So we in a very human-centered way, we recruited extremes. The one silver lining, and there's probably many, about having a very weird community, a very diverse community, is that design benefits from looking at the extremes. It benefits from looking at people's perspectives that have to make their own workarounds to create the experience that they want to have. We use that as a very important part of design research in human-centered design, because if you just talk to the average person here in town, the average person's moderately healthy. The average person doesn't really interact with health care that much. The average person doesn't think terribly much about their health. People at the ends of that, people at the extremes who are having to fill the gaps in for all the different physicians that they're seeing, people at the ends who have to care for multi-generational families, they're the ones who really have these stories to tell. And so one of the very first things is we talked to a spread of folks in the community from lawyers and PhD pointy heads and to bus drivers. We actually went around Cap Metro, rode around with bus drivers to understand the city landscape, to really understand where were the spots people, as bus drivers, could tell were unhealthy and where they were healthy, and unpack that perception, talk to them about what it was like to see different folks in the community as they traverse their different routes. We talked to musicians. This is a music city capital, so we wanted to understand that perspective. So we talked to a lot of folks, and what we found, unsurprisingly, but it was, again, a good reinforcement, is it doesn't matter how smart you are. Healthcare does not discriminate. It will be confusing to anybody. You could be a lawyer, you could be a PhD from UT, you could be an immigrant mom for the first generation immigrant mom trying to figure out healthcare for their kids. Doesn't matter. It's so hard. It's not easy. You frankly don't understand what you're getting, and sometimes you don't understand what to do. So the gaps in care aren't necessarily just the medicine, it's the experience. But we needed to create a way to understand that for what Austin represents, not for what our communities in San Francisco or Palo Alto or Boston, all the places that we're coming from in the medical school have as biased perceptions of what people need. we needed to anchor them in the needs of this community. And so that was the first thing that we did. What it builds on is the diversity that exists here. That's the important part of how you can begin to design much better and perhaps even more desirable experiences, is to understand the workarounds that people have already figured out and to make them the way instead of the back door. That's part of, I think, what you were hinting at in terms of the population here that we want to empower and support. I think the other part is that we have to be willing to learn. Usually we would say that you have to be willing to fail, but failure in different contexts takes on very different meaning. But in design, that's about creating experiments with a very low cost of failure, doing them quickly, not waiting 6 months to create that perfect protocol that we're going to go out into the community and hope to launch. It's like, let's create it in less than a week. Get in front of people. What do you think? Is this better or worse for you? If not, we can make it better. We haven't invested the whole farm into this idea so it can change. I think the willingness for the medical school to embrace change and to learn is probably one of the most important qualities to be able to anticipate how we can continue to strive to deliver care for everybody here in the community, not just the poor, not just the rich, everybody. That for me really plays an important role in the opportunity space that designers have to create new things. It can't be prescriptive. You have to build on what is here.
No, that's great. And just to let you all know that one of the major areas that we're focusing on, we have most of the work the medical school is doing in the city of Austin is actually not directly through assets it controls, which makes it very hard, right? So we're working with physicians that have their own practices, hospitals that have their own leadership, et cetera, communities that have their own accountability organizations. So it makes it hard, but it makes it real, and it allows whatever we develop here then to be more replicable as a result. So that's the difference between what we're trying to do here versus, say, a Kaiser or a Cleveland Clinic or something which are some great examples where they're very controlled. But one of the places where we have more control is one of our buildings, and most of you have seen the cranes and the construction. One of the buildings is we're calling it now the
Health Transformation
Building.
It's gone through like 5 names.
It's a large building on Trinity. But anyway, it was originally designed as a medical office building, but we've taken it back to the mission, and we're creating the future of care in that building as delivered through outpatient clinics. So it's going to have a whole range of outpatient clinics that is being designed top to bottom as what the future of care looks like. And this it means certainly the physical layout and an evolving physical layout that the Design Institute's involved in, operational changes, team-based care, that's of the new model, business models that are new. The last is really important, and I bring this up because there are other places in this country that have these beautiful clinics that have cutting-edge tools, technologies, etc. They are sometimes simulation clinics. Rarely are they actually areas which actually deliver care. Sometimes they do deliver care, but I would argue that none of them really focus on the key business aspect of actually making what they're doing sustainable in the future. And so that is a big focus. And I'd say the heart of the innovation in the Health Transformation Building, and we don't have all the answers, it's something we're figuring out, is that the doors need to be open for everyone. And this is a city that, like many other cities, it's a two-tiered system. If you have a certain kind of public insurance, you go to one group. If you have another kind of insurance, like the kind of privileged insurance that I have, I go to some other group. And probably the heart of the innovation in that building is we want cutting-edge care, fantastic systems, and we want, once you walk through that door, everything is forgotten about who was paying your bill, and you become the person that gets top-notch care. So that's one, and that's a target. As I said, we don't have all the answers. This is very, very hard to do. But again, if you don't have that kind of target, where do you go?
And I just want to say one thing.
Please.
See, that fits neatly with what I was saying about how it's we're trying to do this community-oriented. It's also one of the advantages of having a medical school that starts from the ground up, right? They're not beholden to anyone. It's just that they get to invent it. And that goes back to what I was saying earlier, is without, and you're right, fear of failure, of being willing to learn or not being paralyzed by new ideas, trying things in new ways and then shifting if it doesn't work. I hope and believe it will be the continued way that this school works because of the way the dean and Minnie and Beto and others are leading it right now. I don't know what the definition of smart city really is, but it must be community, and it must involve all of the community, and that's and so I'm pleased with where we seem to be headed in that regard.
No, that's great. I actually want to open it up to questions because we only have 15 minutes left for our panel. I had a whole bunch of other topics that we were going to talk about, and I'll just list them so you have something to think about. But one was the exactly as the senator said, that smart should nothing can be smart without interaction and participation. So that has to be sort of a core part. And I was going to ask folks to speak to that if that's of interest to you all. I wanted to think through financial incentives to keep inducing smartness and smart changes as ongoing changes rather than just sort of one-time initiatives. But first, just a quick sense of this is about health. What do you think is the leading cause of death in Austin, Travis County? Just shout out some answers. This one is not, don't worry, the surprise is coming a few down. Cancer. Cancer. And it's usually the case. Second, somebody said it, heart disease. Yeah, and actually, fourth is stroke. And so if you had cardiovascular, stroke has a lot of cardiovascular pieces to it. Cardiovascular could almost be number one. So it's between cancer and cardiovascular. And even in cancer, a large contributor is lung cancer, by the way, which is influenced highly by environmental smoking, things like that. So both the first two are mostly influenced by non-clinical intervention. So keep that in mind. But what's the third? I skipped the third. Obesity. Not obesity. Homicide. What was that? Homicide. Non-homicide, no. Suicide is like number 9 or so. So very, very serious. Accidents. Accidents. So number 3 cause of death is accidents, road accidents. So when we talk about transportation, I'm sorry we're not going to have enough time to delve into a lot, but I did want to bring it up to say a lot of this is going back to the stats and really and asking what is the question we're asking, and that's just one way of framing the question. The leading cause of death is itself puts a particular spin on health, but it starts revealing what it is we need to work on. So transportation is no longer just a nice to have health and transportation as an intersection point. Addressing transportation absolutely is related to at least one way that we define health. So I just wanted to leave you with that thought as I open it up to questions from the audience. Oh boy, in the red, yes.
I represent a nonprofit that works in the city of Austin for the future, for issues related to the future of aging. You know, the aging population's booming, of course, and when we get to be octogenarians, we're going to have higher expectations about technology and healthcare. So I ask you, where do seniors fit into this whole smart city healthcare thing? And I'm hoping that they have an individual your focus and that you're thinking about this group.
I'll make a quick endorse. So we just brought into our organization a designer by the name of Jose Colucci, and he's actually giving a talk sometime this weekend around aging, and particularly around the ways in which we've learned as designers to begin to incorporate that not only into the ways in which we design new services and products for them, but the ways in which we can incorporate them into the community as continued participants in what is going to be a shared goal to actually allow all of us to realize this goal of measurably improving our health. And so a plug for that talk, you should go see it. The things that are alarming for me is that, obviously it matters to almost every industry you could talk to. The pear-shaped movement of the boomers is just going older and older. That drives an enormous amount of decisions around how people design products and services. It drives an enormous amount of things that we have to support as that population gets older and older. It's an important part of the way we're thinking about holistic care and being able to, even as Amy Young would put it, think about an
Tell them
individual's
who Amy
health.
Young is.
Amy Young is the chair of women's health. She uniquely didn't want to call it, her department, obstetrics and gynecology. She said, women are more than their reproductive system. We need to begin to create programs across the entire lifespan of women from birth to death, part of which is the aging process, part of which is being able to die with dignity, part of which has to create these options for people that allow them to begin to think about their participation in the community as they get older, the role that they play, but also how we support them through the services that we can create.
And I'll add just I love hearing all that, because the promise of trying to provide better, smart, or community city is playing out. But one of the things that you're right about the aging population, and this town, Austin, still considers itself to be an extremely young, even as you have such faith that we're all going to be octogenarians. The truth is, we see the city as a young city. Part of that is the incredible value we get out of having that fountain of youth called the University of Texas, that every year brings new ideas, new thoughts, new music, new culture to our city. But key is we need more physicians because of our aging population. And one of the things that I think that being a smart city, voting the way they did so that we could have a medical school, was that will allow us to do a better job of having a pipeline of physicians. The role that Seton plays in terms of also making sure we have residency slots so that graduate medical education is going on right here in our community in a pretty big way. It was even before we had the vote, but we can the work to expand that so that you have more physicians for an aging population. Key to that is a medical school and more GME so that we're in a position to treat.
It's great question, and I'll just say that intersects with the city like nothing else does. So I know if there's one reason I want to go live in a Scandinavian city when I'm old, is because those cities are, everyone is walking, running, they're walking and running when they're older. The cities are designed to actually be supportive of an aging population. China has these huge, everything China does is massive scale, but they have like 12 cities they're designing almost from scratch, cities for the aged, where they are stepping back and going, what does it mean to design a city from scratch for it? So I think there's the medicine part, which of course, yes, absolutely we're emphasizing, but it's a great place of intersection of medicine, the medical school, but also how the city is designing its growth, its transportation, all of its other features. There's someone in the back.
Hello.
Yeah.
We've heard a lot about community engagement and the importance of community engagement, but you also mentioned about deprivation. And I'm just wondering about the impact of access to technology and thinking about things like citizen science and how members of the community can engage when they may not have access to technology because of issues to do with deprivation. And is there anything that the university or the other organisations are doing to perhaps address this where it may be an issue?
Yeah, absolutely. So technology to me is a very broad, it can mean many different things. Let me describe one technology that folks like Beto are helping us rethink, and that is our emergency medical services. Okay? So our emergency medical services do a particular function right now. What we're interested in doing, and they're very interested in, this is the asset that Austin has. You talked about the will. This is what's wonderful here, is that pretty much every agency, both private or public, every group we've talked to wants to participate in this change because they're so excited. So for EMS for us is not just the way they function today. Instead, we're stepping back and going, well, look, what are they? They are trained professionals that have access to vans that can be called and respond really quickly. They've figured all that out. They know often the people in their homes and actually go into their homes and can see what's actually happening. What if, and there's lots more to it, but as an example, what if we just took those features and then we work backwards from there? And we said, given those features, how would we use them in the health system of the future? That's one example. We could get, but that's an example to me of a technology. That's a technology, a way of getting it. And by the way, embedded in there are true digital opportunities to coordinate the responses to some of the other health needs. But it's a way of rethinking roles that actually map the future of care, which should actually be to people in their homes in ways where it should matter less whether they have access to specific digital technologies or not. Is that good, Beto? That's our...
Perfect.
Yeah.
High impact, not high cost. We can do so many things that don't mean bringing an iPad into every little situation you can imagine. It's about understanding the needs and just creating solutions that actually get to a meaningful outcome. So much of it gets caught up into the latest and greatest technology. What can you buy, not what do you need?
Great.
But-
Steve? Sorry, go ahead. Yeah.
Remind me what it was, we were in a meeting the other day where they were talking about some sort of eye test, that instead of needing to bring people in to do the eye test, the doctor was saying that they could go with a phone and do the eye test, and what they could do is they would send like a social worker to do the eye test, because then that would also allow them to see 3, 4, 5 different things going on in the home that might impact health as well. So that the schools...
That's a great example of technology that being brought in, so even if someone doesn't have access to it, we bring the technology
Right.
in, and absolutely. Steve?
Thank you. And thank you, Senator, for bringing such smart, passionate people to Austin.
Well, I would like to take credit for that, but isn't it
Well,
great to have
you
them
played
here?
a big role,
Yeah.
as my taxes will prove.
Yeah, it's so great
One
to have them.
about one aspect of being smart is having courage, and part of courage is saying realistically what's happening. And there's a huge myth, actually, as you know, Austin as a fit city. In reality, in Travis County, almost 6 out of 10 of us adults are obese or overweight, 58%. Huge cost. So can you speak for a moment about how you see population preventive health actions, definitely in transportation and others, but what do you see as a vision for us to be able to tackle that so that everyone can enjoy the benefits of a healthy life?
I've always tried to be a compact senator for a compact city, so.
Who wants to take it?
So I think that there's definitely some bright spots in Austin with regard to urban design, street design. You see in cities and communities and really neighborhoods nationwide where there's access to safe sidewalks and as I was speaking about earlier, walkability of neighborhoods. It's a significant reduction in obesity and cardiovascular issues. And I think that, you see it'd be great to see sort of the expansion from an urban design standpoint of things like what we have the Great Streets program here in downtown Austin, expansion of that kind of approach to the roads here. And then if you look at, from a transit standpoint, neighborhoods where there's 5 to 10 minute walking distance to a transit stop, you see a dramatic improvement in health in those areas. And I think that there's some very interesting connection points just between public transportation, urban design, and citizenry health. So.
Now, out on the food side of it, because being fit and healthy is about exercise, which I have a bad time with myself, so I have my own personal goals on it, but food is a big piece as well. And again, there I'll go to those that don't have access to fresh food. And so there are some intersections between some financial incentives and eating healthier. So for example, the SNAP program and the Sustainable Food Center now has a double your money on the vouchers you get, so that if you use the vouchers in a farmer's market for fruits and vegetables, you can get double the value, which is great because it reinforces the farmer's market, which has other kinds of economy growing kinds of aspects to it, as well as incentivizes eating healthier. I mean, these are small inroads into a much bigger problem. But yes, we have to, if we're a medical school that innovates by focusing on health, not healthcare, then we need to be in the business of wellness. And so to be in the business of wellness is a very different game, and again, is one that we are inventing, since no other medical school is in the business of wellness. So what the hell does that look like? And also, what is the business of wellness? It's not just a medical school. No one has really figured that out, whereas this is such a frustrating area because there's so many places in health and healthcare where you can just give the answer. You can give the answer. You can show the evidence that providing housing for the high users of multiple services reduces their healthcare needs, which means they're doing better, and significantly reduces the spending that a region does. And yet going from evidence to action is so hard. And this is not just like incremental changes. There are many such areas where it's so obvious that if you do better on education, on, et cetera, if you invest, then you will recoup it as a society. And so you see those answers in front of you, and yet there's almost no one to go, you don't know who to go to. Who can I tell? Here's this better deal. It's going to give you these great outcomes at a lower cost. So that's part of the frustration, I think, in health and healthcare, but we are taking it on. We're not frustrated and going, F it, we're frustrated, we're going to try to fix it.
Two quick things. The permanent, what she just talked about on home, she makes a reference to homelessness. If we were to spend more resources in making sure we had like permanent assisted housing where people had wraparound housing for some of our high-end users, we would make a real difference. The second thing is we are doing it differently. The Uniquely Austin Clinic that we just expanded in southeast Travis County, we call it a wellness center. And it has educational opportunity for how to eat better. It even has garden opportunity for growing healthy foods and vegetables and things of that nature. So again, the smart community aspect of it is trying to focus on it differently.
I'll add one thing that you learn when you look at a different kind of extreme, which is that if you go and talk to the athletic department at UT, which actually is tasked with and has the steward to improve already great athletes into elite athletes, you see that the thing that they actually do is that they coordinate a lot of the things that need to come together to maintain that performance measure that they're trying to achieve or improve it. One of the anecdotes that we learned talking to the athletic director was that a lot of our students come in not knowing how to care for themselves, not knowing how to eat healthy. They've naturally just metabolized and have done things, but it gets harder once you start creating more competition. And so they pulled together so many different resources. It's just not about training. They pulled together a nutritionist. They pulled together a mental health specialist. They pulled together time management specialist that lets them understand how, when, and where to begin to organize their stuff. I think we all struggle with that. I mean, if you take a step back, I struggle with my health and weight and fitness and all the time. And it's that I've not really understood how to coordinate all those things. When you look at an extreme example of an elite athlete, that's being done for them. There are lessons to learn there that we can begin to incorporate and integrate a lot of disparate organizations that are active today in the community that aren't talking to each other to improve someone's health around a common goal.
Great. Well, we're actually out of time, unfortunately. But this has been fantastic. And the one thing I did want to just, riff on maybe throughout, we started with that word smart, and I know each one of us in different ways is a reaction to the word smart. I don't know if you all do. Any better words than smarts, or maybe smart is good?
I'm not smart enough to know.
There you go. See, that's what happens. You start assessing yourself against it. I know Beto has a strong opinion.
Oh, I don't.
Smart city, fun city.
Fun's nice. No, it's I know lots of other words: anticipatory, participatory, personalized. We got to get away from this idea that it's some abstract thing that someone's doing for us. It's really a deliberate and intentional act, as opposed to just being, like smart water. It just makes you smarter. We don't have smart water. We have Ozarka.
Smart city is a city you come to suddenly become
right.
Smarter.
Electrolytes are in the water, so you're gonna be smart.
All right. Well, I do know that health needs rebranding, because I can tell you, 10 plus years ago, whenever we were talking about healthy foods, I was the last person on the list to have them, and I have the reaction my father has now, which is, please don't tell me something is healthy. Please don't tell me something is organic, is his reaction when he goes to the markets here, because I'm sure it's not tasty and it's not good. And so health is actually one thing, or healthy, that I feel like we should buzz up a little bit, because it's just not, healthy doesn't seem fun enough this year. So that's a challenge I put back to you to think about post this session. But thank you. I wanted to thank all my guests.
Thank you all.